A tragedy is unfolding inside New York's virus epicenter. In a city ravaged by the coronavirus, few places have suffered as much as central Queens, where a 7-square-mile patch of densely packed immigrant enclaves recorded more than 7,000 cases in the first weeks of the outbreak. Across New York, there was a relatively encouraging sign on Thursday. Hospitalizations remained nearly flat for the first time since the lockdown began. But as the death toll has mounted, the contagion has exposed the city's stubborn inequities, tearing through working-class immigrant neighborhoods far more quickly than others. A group of adjoining neighborhoods, Corona, Elmhurst, East Elmhurst and Jackson Heights, have emerged as the epicenter of New York's raging outbreak. As of Wednesday, those communities, with a combined population of about 600,000, had recorded more than 7,260 coronavirus cases, according to data collected by the New York City Department of Health and Mental Hygiene. Health officials have not released data on the race or ethnicity of the people who are sick, and officials from the Department of City Planning cautioned against drawing broad conclusions based on zip codes, which is how the city has released limited information about positive cases. Yet healthcare workers and community leaders say it is indisputable that the pandemic has disproportionately affected the Hispanic day laborers, restaurant workers and cleaners who make up the largest share of the population in an area often celebrated as one of the most diverse places on Earth. Latinos comprise 34% of the deaths in New York City, the largest share for any racial or ethnic group, according to data released by state officials on Wednesday. The city-run Elmhurst Hospital Center was one of the earliest and hardest hit by the virus. In their daily toll of the fallen, city and state health officials have not disclosed where exactly deaths are occurring. Doctors and community leaders say poverty, notoriously overcrowded homes and government inaction left residents especially vulnerable to the virus. City officials rejected the suggestion that they left the city's immigrant neighborhoods to fend for themselves. Officials mounted multilingual public service campaigns in subways and on television, and have provided continuous updates to the ethnic media, including on the need for social distancing. He slathers his hands with sanitizer throughout the day but worries about his mother and sister, both of whom are sick at home but have been unable to get tested. But then her mother, who was struggling to breathe, needed to be taken to the hospital. Ms. Rivera, 38, took her to Flushing Hospital Medical Center, but came home worried she would infect her own crowded household, which includes a 70-year-old uncle. City officials say they are working to address the problem. Mexican grandmothers share recipes for traditional herbal fever remedies, Pakistani drivers deliver home-cooked meals, and Nepali volunteers, including Mr. Nembong, the cousin of the driver who died, are distributing protective gear to those who must keep working. If you've been exposed to the coronavirus or think you have, and have a fever or symptoms like a cough or difficulty breathing, call a doctor. This is a shift in federal guidance reflecting new concerns that the coronavirus is being spread by infected people who have no symptoms. Until now, the CDC, like the WHO, has advised that ordinary people don't need to wear masks unless they are sick and coughing. Part of the reason was to preserve medical-grade masks for healthcare workers who desperately need them at a time when they are in continuously short supply. Masks don't replace hand washing and social distancing. If you're sick and you think you've been exposed to the new coronavirus, the CDC recommends that you call your healthcare provider and explain your symptoms and fears. If the family member doesn't need hospitalization and can be cared for at home, you should help him or her with basic needs and monitor the symptoms, while also keeping as much distance as possible, according to guidelines issued by the CDC. If there's space, the sick family member should stay in a separate room and use a separate bathroom. Yes, but make sure you keep 6 feet of distance between you and people who don't live in your home.